Are you on a high-carb diet? It's super popular, especially with athletes and those on plant-based or weight loss plans. But did you know that it might be secretly affecting your B vitamin levels? B vitamins are crucial for energy, brain function, and metabolism. And if you're not getting enough, you could be setting yourself up for fatigue, brain fog, and more. In this video, we're diving into how high-carb diets might be sabotaging your B vitamin intake and what you can do about it. Stick around to the end for some simple solutions, and don't forget to like, subscribe, and share this video if you want to stay on top of your health. B vitamins are a group of essential water-soluble nutrients that help convert food into energy, support neurological function, and maintain healthy skin, hair, and digestion. There are several types of B vitamins, each serving a unique function. Vitamin B1, also known as thiamine, is essential for energy metabolism and nerve function. A deficiency can lead to conditions like beriberi, which affects the heart and nervous system, and Wernicke-Korsakoff syndrome, a serious neurological disorder. Vitamin B2, or riboflavin, aids in red blood cell production and energy release. Riboflavin is also crucial for maintaining proper skin health and eye function. Vitamin B3, also known as niacin, supports digestive health, skin function, and mental well-being. Severe deficiencies in niacin can lead to pellagra, which is characterized by diarrhea, dermatitis, and dementia. Vitamin B6, or pyridoxine, is crucial for brain health, mood regulation, and protein metabolism. It also plays a role in neurotransmitter function and immune response. Vitamin B12, or cobalamin, is vital for red blood cell formation, DNA synthesis, and neurological health. A lack of B12 can cause anemia, nerve damage, and cognitive impairment. B vitamins also include biotin or B7 folate, which is B9, and pantothenic acid, known as B5. Each of these vitamins contributes to various essential bodily functions. A deficiency in any of these vitamins can lead to significant health issues, making it essential to understand how dietary choices impact their levels. A high-carbohydrate diet typically consists of 55 to 75% of total daily calories coming from carbs. Common sources include whole grains, brown rice, quinoa, oats, whole wheat products, and barley, which provide fiber and essential nutrients. Fruits like bananas, apples, berries, and oranges offer natural sugars, fiber, and vitamins. Legumes such as lentils, chickpeas, black beans, and peas provide a mix of protein, fiber, and slow-digesting carbs. Refined carbs, including white bread, pasta, sugary cereals, and pastries, are often stripped of fiber and nutrients but provide quick energy. High-carb diets can provide quick energy, enhance athletic performance, and contribute to weight loss when properly balanced. However, an over-reliance on refined and processed carbohydrates may come at the expense of essential micronutrients like B vitamins. Additionally, diets that include excessive sugar intake may contribute to metabolic imbalances, increasing the demand for B vitamins to process and metabolize glucose efficiently. This creates a paradox where a high-carb diet could lead to an increased need for B vitamins while simultaneously limiting their intake through poor food choices. While carbohydrates provide necessary energy, their consumption, especially in processed forms, can negatively impact B vitamin levels. Here's how. Many high-carb diets are centered around refined carbohydrates like white bread, pasta, and baked goods. While these foods may provide quick energy, they come at a cost. During the refining process, the natural nutrients, including vital B vitamins, are stripped away. This leaves the grains depleted of many of their original nutrients, including B1 or thiamine, B2, also known as riboflavin, and B3 or niacin. While some processed foods may be enriched with synthetic versions of these vitamins, they still don't provide the full spectrum of nutrients found in whole grains. Whole grains, like brown rice, quinoa, and oats, retain their B vitamin content, making them a much healthier choice for those looking to maintain optimal vitamin levels. Quick reminder, hit that subscribe button to stay ahead with more expert health tips. Increased demand for B vitamins. When you eat a lot of carbs, especially refined carbs, your body requires more B vitamins to break them down and convert them into energy. B1, also known as thiamine, B3, known as niacin, and B6 or pyridoxine, play key roles in the metabolism of carbohydrates. The more refined carbs you consume, the higher your demand for these vitamins becomes. Unfortunately, the diet that supplies your carbs often doesn't provide enough B vitamins to meet this demand, leaving you in a nutrient deficit. If your B vitamin intake doesn't match the increased need, you could experience symptoms of deficiency like fatigue, mood changes, and cognitive issues. Reduce nutrient absorption. High sugar intake, which often accompanies high-carb diets, can damage gut health over time. When you consume too many processed carbs or sugary foods, it can disrupt the balance of beneficial gut bacteria and weaken the gut lining, leading to what's known as leaky gut. Impaired digestion. This compromised gut health reduces the body's ability to absorb nutrients from food, including essential B vitamins. Even if you're eating foods rich in B vitamins, your body may struggle to extract them properly due to impaired digestion. As a result, you could experience a slow decline in nutrient levels, further exacerbating deficiencies. Alcohol and high-carb diets. Alcohol and high-carb diets, a common pattern among people on high-carb diets, is also the consumption of alcohol. This combination can be especially problematic for B vitamin levels. Alcohol, particularly when consumed in excess, interferes with the absorption and metabolism of several B vitamins, including thiamine, B1, which is essential for energy production and brain function. Chronic alcohol consumption can impair the liver's ability to store and release B vitamins, which are crucial for maintaining various bodily functions. When paired with a carb-heavy diet that already strains the body's B vitamin reserves, alcohol further depletes these vital nutrients, making it even harder to maintain balance in your diet and energy levels. Studies have shown that populations with diets high in refined carbs often have lower levels of B vitamins, leading to potential health complications over time. A study published in the Journal of Clinical Nutrition found that individuals consuming high levels of refined grains had a greater likelihood of thiamine and riboflavin deficiencies compared to those who prioritized whole foods. Signs of B vitamin deficiency. If you consume a high-carb diet and experience any of the following symptoms, you might be deficient in B vitamins. Persistent fatigue and weakness, indicating a lack of efficient energy production. Mood swings, anxiety or depression which may result from neurotransmitter imbalances due to low B vitamin levels. Brain fog, forgetfulness, and difficulty concentrating linked to inadequate B12 and B6 intake. Frequent headaches or dizziness which may signal poor oxygen circulation due to anemia caused by B vitamin deficiency. Skin issues like dermatitis, acne, or cracked lips, often associated with a lack of riboflavin, niacin, or biotin. Tingling or numbness in hands and feet, potentially indicating nerve damage from prolonged B12 deficiency. Recognizing these signs early can help prevent long-term health issues by making necessary dietary adjustments and seeking medical advice if needed. Tips to maintain healthy B vitamin levels. To ensure adequate B vitamin intake while following a high-carb diet, consider these strategies. Prioritize whole grains. Swap refined carbs for whole grains like quinoa, oats, and brown rice, which retain their B vitamin content. Incorporate nutrient-dense foods, include legumes, leafy greens, eggs, dairy, nuts, seeds, lean meats, and fish to support overall B vitamin levels. Balance macronutrients. Instead of overloading on carbohydrates, balance your diet with adequate protein and healthy fats, which support nutrient absorption and metabolic balance. Consider fortified foods. Choose cereals and plant-based milk fortified with B vitamins, especially if you follow a vegetarian or vegan diet, where B12 intake may be limited. Supplement, if necessary. If you suspect a deficiency, consult a healthcare professional about taking a B-complex supplement to ensure optimal levels. Individuals with conditions affecting absorption, such as celiac disease or Crohn's disease, may particularly benefit from supplementation. While high-carb diets can provide essential energy and support active lifestyles, they may also pose risks to B vitamin levels if not properly managed. Consuming an abundance of refined carbohydrates can lead to deficiencies that impact energy, brain function, and overall well-being. By incorporating whole, nutrient-dense foods and maintaining a balanced macronutrient intake, you can enjoy the benefits of a high-carb diet without compromising your B vitamin levels. Pay attention to your body's signals and make informed dietary choices to support your long-term health. Did you know that studies show up to 92% of vegans and 47% of vegetarians may be deficient in vitamin B12? This is a startling statistic that many people are unaware of. Vitamin B12 is crucial for our body's proper functioning, and a deficiency can lead to serious health issues. This is a startling statistic. It highlights a crucial health concern for those following a plant-based lifestyle. Vitamin B12 is essential for the production of red blood cells, DNA synthesis, and the proper functioning of our nervous system. It highlights a crucial health concern for those following a plant-based lifestyle. Without adequate B12, individuals can experience fatigue, weakness, constipation, loss of appetite, and even neurological changes such as numbness and tingling in the hands and feet. Vitamin B12 is not easily obtained from plant sources. This is because B12 is primarily found in animal products such as meat, dairy, and eggs. For vegetarians and vegans, this poses a significant challenge. This makes it an essential nutrient to be mindful of, especially for vegetarians. Fortunately, there are ways to ensure adequate intake of B12. Supplements and fortified foods are excellent sources that can help bridge the gap. This isn't just about numbers, it's about people. Real people who are trying to live healthier lives by choosing a plant-based diet. They need to be aware of the potential risks and take proactive steps to mitigate them. People like you and me who care about their health and well-being. It's important to understand that a balanced diet is key to maintaining good health, and sometimes that means supplementing where necessary. A deficiency in vitamin B12 can lead to a range of health problems. These include anemia, nerve damage, and cognitive issues such as memory loss and difficulty concentrating. In severe cases, it can even lead to irreversible damage. These can be serious if left untreated. Regular checkups and blood tests can help monitor B12 levels and ensure that any deficiency is caught early and managed effectively. The good news is that awareness and proactive measures can help prevent and address this issue effectively. By incorporating B12 supplements or fortified foods into their diet, vegetarians and vegans can enjoy the benefits of their chosen lifestyle without compromising their health. Vitamin B12 is a vital nutrient. It plays a crucial role in many bodily functions. You need it for cell growth and development. It also helps your nervous system function correctly. Without enough B12, your body cannot produce red blood cells efficiently. These cells carry oxygen throughout your body. This can lead to fatigue and weakness. In severe cases, it can cause nerve damage and anemia. Vitamin B12 is like a spark plug for your body's engine. Without it, your body can't function at its best. Vitamin B12, also known as cobalamin, is a complex molecule with a big job. One of its primary functions is in cell division and growth. This is essential for the creation of new cells, including red blood cells. B12 also plays a crucial role in DNA synthesis, the blueprint for every cell in your body. Beyond that, B12 is vital for nerve health. It helps maintain the myelin sheath, a protective covering around nerve fibers that ensures efficient transmission of nerve impulses. Without adequate B12, nerve damage can occur, leading to tingling, numbness, and even problems with balance and coordination. Vitamin B12 is primarily found in animal products. This includes meat, poultry, fish, eggs, and dairy. Plants don't naturally produce B12. This means that vegetarians who exclude these foods from their diet are at a higher risk of becoming deficient. While some plant-based foods may be fortified with B12, it's crucial for vegetarians to be aware of their intake and consider supplementation if needed. Don't rely on just fortified foods. Talk to your doctor. They can help you figure out how much B12 you need. Real quick, if you're finding this helpful, be sure to subscribe for daily videos to help you live a healthy lifestyle. B12. Deficiency. Recognizing the warning signs. Vitamin B12 is an essential nutrient that plays a vital role in many bodily functions, including the production of red blood cells and the maintenance of the nervous system. Without adequate levels of B12, your body cannot function properly, leading to a range of health issues. Recognizing the signs of B12 deficiency early on is crucial for preventing serious health complications. Early detection can make a significant difference in managing and treating the deficiency before it leads to more severe problems. While symptoms can be subtle initially, they tend to worsen as the deficiency progresses. One of the most common early signs is persistent fatigue. You might feel unusually tired even after a full night's sleep or find it difficult to complete your daily tasks without feeling exhausted. Keep an eye out for persistent fatigue and weakness, even with adequate rest. This kind of tiredness is not just about feeling sleepy, it's a deep, bone-weary exhaustion that doesn't go away with a nap or a good night's sleep. Tingling or numbness in your hands and feet is another red flag. This sensation, often described as pins and needles, can be a sign that your nerves are not functioning properly due to a lack of B12. This is a sign of nerve involvement. Nerve damage from B12 deficiency can become permanent if not addressed promptly, so it's important to take these symptoms seriously. Pale skin, shortness of breath, dizziness, and a sore or swollen tongue can also indicate B12 deficiency. These symptoms occur because B12 is crucial for red blood cell production, and a deficiency can lead to anemia. If you experience any of these symptoms, especially if you follow a vegetarian diet, consult your doctor for proper diagnosis and treatment. Vegetarians and vegans are at higher risk for B12 deficiency because this vitamin is primarily found in animal products. Your doctor can recommend dietary changes or supplements to help you maintain healthy B12 levels. Meeting your needs. How much B12 is enough? The recommended daily intake of vitamin B12 for adults is 2.4 micrograms. However, individual needs may vary. Pregnant and breastfeeding women, for instance, require slightly higher amounts. Factors like age, absorption ability, and health conditions can also influence your B12 requirements. It's always best to consult with your healthcare provider to determine the appropriate dosage for your specific needs. B12 on a plant-based plate, your guide to vegetarian sources. Good news! There are plenty of ways for vegetarians to get enough B12. Many foods are fortified with B12. These include plant-based milk, breakfast cereals, and nutritional yeast. Nutritional yeast has a cheesy flavor. It's a great addition to many dishes. You can sprinkle it on popcorn, pasta, or use it in sauces. Taking a B12 supplement is another reliable way to ensure adequate intake. Talk to your doctor about the right type and dosage for you. Unmasking a deficiency testing and early detection. If you're concerned about your B12 levels, a simple blood test can provide a clear picture. This test measures the amount of B12 in your blood. It's a good idea to get tested regularly if you're vegetarian or vegan. Early detection of B12 deficiency is key. It can prevent long-term health issues. Remember, knowledge is power when it comes to your health. Your B12 action plan. Taking charge of your health. In this section, we will explore the importance of vitamin B12, especially for those following a vegetarian or vegan lifestyle. Vitamin B12 is crucial for many bodily functions, including the production of red blood cells and maintaining a healthy nervous system. Taking charge of your B12 intake is essential for maintaining optimal health, especially if you follow a vegetarian lifestyle. Assess your diet to ensure it includes B12-rich foods. Many plant-based foods are not naturally high in B12, so it's important to be mindful of your choices. Incorporate fortified foods like cereals, plant-based milks, and nutritional yeast into your meals. Make sure you're getting enough B12 from fortified foods or supplements. Fortified foods are an excellent way to boost your B12 intake without making significant changes to your diet. Look for products that specifically mention B12 on their labels. Additionally, consider taking a daily B12 supplement, especially if you have dietary restrictions that make it challenging to get enough from food alone. Talk to your doctor about your individual needs and any concerns you may have. Your healthcare provider can offer personalized advice based on your health history and dietary habits. They may recommend specific supplements or dietary adjustments to ensure you're meeting your B12 requirements. Regular blood tests can also help monitor your B12 levels and catch any deficiencies early. Remember, knowledge and proactive steps can help you thrive on a plant-based diet while avoiding the pitfalls of B12 deficiency. Educate yourself about the best sources of B12 and stay informed about new research and recommendations. Cooking at home allows you to control the ingredients and ensure you're getting the nutrients you need. Shopping for nutritious food and reading labels can also help you make better choices. Do you have any experience with vitamin B12 deficiency or tips for maintaining healthy levels on a vegetarian diet? Many people have faced challenges in maintaining adequate B12 levels, and sharing your experiences can help others. Whether it's a particular brand of supplement you trust, or a recipe that incorporates fortified foods, your insights are valuable. Share your thoughts in the comments below. And if you want to learn more about how to prevent vitamin deficiencies, watch this next video.